Hello and welcome to this week's edition of Talk Time. This week we are talking tuberculosis. What is it? Tuberculosis. How prevalent is it? Are we fighting it sufficiently? And if you're fighting it sufficiently, are we likely to win the fight? Welcome to Talk Time. Welcome back to Talk Time, and as I indicated from the beginning, we are talking about tuberculosis. And we are looking at tuberculosis in all of its dimensions. What is it? What kind of damage does it do to our society? Can it be prevented? Are we preventing it? And so on. And we are particularly happy to have with us in the studio Mr. David Kwesi Afreh, who happens to be the chair of the Stop Tuberculosis Ghana. Stop Tuberculosis Ghana.
Partnership Ghana.
Stop Tuberculosis Partnership Ghana. So you're welcome to the studio.
Thank you, Uncle Kwesi. Nice meeting you today.
What about tuberculosis excites you?
Thank you so much. I'm most grateful to you and your people for giving us the opportunity to express the need of controlling tuberculosis or speeding the control of tuberculosis in Ghana. TB is a killer disease. Tuberculosis is a disease that affects all kinds of people. It affects children under 5, it affects the young, women, children, it affects the old, it affects all kinds of classes. And so in my family, I've had a situation where we've had to virtually bury some of my family members because they've had TB, and some of them even died of multi-drug resistant TB. I've had a situation where we had somebody even dying of TB, HIV. And so for me, it became necessary for me to join the fight against tuberculosis. And that is the reason why we have become a civil society actor, working with Omega Project Management Foundation, and ended up being part of the Stop TB Partnership Ghana, and then eventually became the leader of the Stop TB Partnership Ghana. And so tuberculosis is a killer disease. If you come to Ghana, it will interest you to know that statistics shows that if you take every 100,000 Ghanaians, you will find a minimum of 134 positive TB cases.
So that's like 1 in 100.
In every 100,000 Ghanaian population, you will find a minimum of 134 active persons living with TB disease that need to be detected and cured. What it means is annually we are expected to find a total of about 44,000 persons that are living with the disease in this country, and put them on treatment, treat them and make sure they are cured. The interesting thing about it is that we are not able to achieve these results. The National Tuberculosis Control Program under the Ghana Health Services is in charge of the TB control. The Stop TB Partnership Ghana supports them in advocacy and also community TB screening. We've realized that we are not able to achieve even 17,000 in any of the years. Instead of attaining 44,000, we are running around 16,000, 16,500 each year.
But where is the alarm coming from? Malaria kills more than that.
Malaria is a killer disease also. But
and it kills far more than tuberculosis.
In Ghana, you have a minimum of 3 people dying every day of TB. The speed of malaria and its devastation or contraction is different from TB. You know, you don't transfer malaria from one person to the other. It's from mosquito bite and others, so easy to control. But tuberculosis is a bacteria that is inherent in our system, and almost everybody, because of the sub-Saharan humidity, we are all already with what we will call latent TB. And so you just have to control your lifestyle and watch your life and make sure that you don't deteriorate in health and then it comes up. And so for TB, the numbers are huge. And see, this is why it is because of the numbers that are huge. And the control is hard. So for example, if you detect TB, it will take a minimum of 6 months to get a person treated. A minimum of 6 months.
Why?
Yeah, that is how strong the bacteria is. So if I am detected, diagnosed TB positive, you have to be on the drugs for a minimum of 6 months. So
treatment can start, but then you get healed after 6 months.
Yes, so you will be on the drug, the medication for 6 months. And that is the lowest. Some would have to go for about 9 months. That is become a multi-drug resistant TB. And sometimes it is even extra multi-drug resistant. Some even go to the tune of 2 years, 24 months, 1.5 months. And all of these are managed by the clinicians and all of that. And so if TB is in your family, advocacy, which it is, but if the active disease comes up, anybody that is living with you in your environment, in your room, in your household, in your office space, they are at a higher risk, and therefore we need to make sure that we wage a war against tuberculosis. And see, this is the reasons why, our global office, Top Tea Partnership Geneva, we've been able to have global discussions with the United Nations. And this is why in 2018, especially, exactly 23rd of September, all presidents of nations in their United Nations General Assembly, as part of the assembly, had the high-level meeting on TB. And all presidents, including our dear His Excellency Nana Addo Dankwa Akufo-Addo, signed on to certain targets that are set for every nation to go, every political leader to go, put their own political will on ensuring that we finance TB prevention, care, and treatment in the countries.
Now, if tuberculosis is that dangerous, why do we wait for it to attack us before we launch an offensive?
The TB control has been in existence for long. Maybe it is now that we are having a lot of media engagement and advocacy around it. Otherwise, TB has been with us for more than 20 years. As far back as 1996, the United Nations General Assembly declared TB as an emergency, just as we have had COVID declared as a pandemic, and we've gone through the process and all of that. It's with us the same way. So it has been with TB.
When TB is declared as an emergency, what does it really mean? I mean, that's the substance of my question. What does it really mean?
What it means is very simple. The numbers, people who are dying of TB, the numbers are huge.
Yeah, it has been declared as an emergency.
Yes.
It's been said to be a big killer.
Yes.
And so on. What happens?
What it means is that we need to put every machinery that we can as a country, as a nation. So it's a global disease. It's in every country. Okay? And so when it is declared as an emergency, it means that we are tracking the figures, and we can see that it is wiping away a lot of people. And therefore, we need to tackle it and make sure we end it. And that is why the global agenda to end TB is to end TB by 2030, which has to do with 7 years from now. What it means is that if we can do all the necessary innovative financing, we can do all the necessary effective diagnostic systems in place, put the most effective treatments in place, we should be able to make sure that we launch campaign of screening all people who will be presumed of TB in this country or in all countries, and ensure that we treat them, cure them, so that transmission of TB bacteria and all of that can cease. It is possible, and that is why the campaign is on. This year we are going to go again to New York, okay? On September 2022, on September 22nd this year, 2023, we are going to meet our president back. The nations, United Nations are meeting, and civil society will be there for them to organize another session for TB. And what it means is, are we being accountable to ourselves? Are we checking the numbers of people who are dying? Are we checking the burden that is on us? How much political power have we brought on board to make sure that we finance TV, we make sure the program is effective? How are we ensuring? So the President of Nations will be there to account to what they have signed on to in 2018 September. And then we renew the commitment to make sure that when we come back to our countries, we are able to make sure we do what we need to do to make sure we end TB.
So, your organization, Stop TB Partnership Ghana.
Yes.
It's a private organization, I suppose.
It's a non-governmental organization.
It's a private organization.
Yes.
Okay. Which are the organizations working for the state which are also involved in this exercise? Okay,
so the Stop TB Partnership includes the public sector. So you have, for example, the National TB Control Program manager as part of the board to provide technical oversight and technical direction. You have the academia who are into research. So the academia is involved in the board. You have civil society, that's non-governmental organizations who are involved in community level service provision to support the national program. So we have the National TB Control Program under the Ghana Health Services. That is actually the organization, the state agency that is mandated to control TB. Just as we have the National AIDS Control Program, we have the National Malaria Elimination Program, we have the National TB Program, right under the Ghana Health Services, the Director General of the Ghana Health Services, to ensure that TB program is run across the country. So when you go to regional level, the regional deputy public health directors are in charge. You have regional TB coordinators, TB focal persons. You go to the district level, you have the Ghana Health Service district health management team having TB focal persons. Even at facility level in the regional hospitals, all district government hospitals, you have people who are positioned to make sure that their eyes are on screening people and getting them treated when they are found to be positive.
Well, we're also going to take a short break here, and when we come back, we're posing some very interesting questions. You know, I mean, TB, tuberculosis, say it's so devastating. And yet, it does appear that the main organ dealing with this is a non-governmental organization, even if it has participation by state operators. When we come back, I'd like you to respond to that.
Thank you.
Hello, information.
Madam,
Me, I have still not got the money for that list of expensive building materials you sent to me. The price of the iron rods have been increased too much, had I?
Madam, relax. Look, that's not why I even called. I just visited IPCP, where the engineers told me everything about Trasacco fast floor.
Trahuako, please, those people are expensive. Are they not the people building those big houses in town? I beg, don't catch any guy.
Madam, in fact, I used to think the same until I visited their office today, and they gave me an estimate of how much it will cost. Yomo, the estimate is free. It's cheaper than the one I even sent you.
Wow.
Building contractors, foremen, masons. Visit IPCP, the Trasacco Fast Floor. Engineers will assist you build an affordable, faster and stronger building.
Oh, madam. It is done.
Wow.
Trasacco Fast Floor. Stronger, faster and affordable.
This is a Trasacco construction product.
Yeah, hello and welcome back to Talk Time, and we are in conversation with Mr. Afreh, who is the board chairman of the Stop TB Partnership Ghana.
Yes.
Now, before we went on break, I posed the question, I mean, if it's such a threat to the national development effort and so on, how come that your private organization or non-governmental organization appears to be taking the lead?
Okay, so it's important to put this on record that taking the lead is just the advocacy to make sure that we have government commitment towards TB. The program of national TB control is responsible for TB control in Ghana. So there is government recognition and government program established to ensure that TB is controlled. I think the biggest challenge, why did we come up with this TB partnership? To ensure that we are able to collaborate to ensure we end TB. It is because of the deficiencies. We have poor coverage. Okay, we don't have diagnosis in every district in Ghana. Okay, you don't have enough resources to make sure that.
What does that mean? I mean, what is it that is not available in the regions? Okay, so for tuberculosis detection.
Okay, so you don't find the machine we use to detect TB, for example, is called a GeneXpect machine. It used to be the normal microscopy, but of course, as time went on, there was a better and a more efficient or effective tool. And so then Ghana adopted the GeneXpect machine that is now used to detect TB in the laboratory. And so you have, 270 districts in Ghana, and yet we have about 128 of these machines across the country. And so we have more than, we are covering, we have about a quarter of Ghana that is not having these machines. And so what it means is that diagnostics is far away from some people. For example, that is why the Stop TB partnerships, non-governmental organizations that are across the country are able to map out a system where you have to do what we call house-to-house community screening to detect, to determine those who become presumed that can be TB, and then you collect their sputum, because you take the sputum to screen. Even though TB affects all kind of parts of the body, it is predominantly attacking the lung, and so we use the sputum. Civil society collects sputum from all kind of places and communities, and have to use the motorbike, the bicycle, to transport those sputum to the nearest GeneXpect sites, of course, all in collaboration with the district health management team at that level. And so, what are we calling for? We are calling for making sure that we finance TB fully. If we can get all districts in Ghana having the machine, it means that you are having treatment access closer to the people. That is one thing. Now, once you have the GeneXpect machines in all those places, are you able to ensure that all the other supplies, because it's not just a machine, it works with other parts like the cartridges. There are times that in this country there is shortage of cartridge. You wake up one day and the supply chain is cut somewhere, and then you cannot find the GeneXpect machines cartridges. Sometimes it's sputum container that is missing. It's short in the system, and so we just have to ensure that we advocate. We are civil society. We are non-governmental. We are non-religious and non-political, and our duty, non-partisan, and our duty is to make sure that we trumpet it for the duty bearers at all levels, especially at this very moment, because we are on the tangent of talking about ending TB by 7 years' time, which is 2030. How can we get our president, His Excellency Nana Addo Dankwa Akufo-Addo, who in himself has recognized the devastating effect of TB and went to sign on to a certain commitment for Ghana, and have come back to make sure that these things, what he has committed to, are done. Now, we haven't done too well because we have not achieved those targets, and we are going back again to sign or to review commitment. And so we are interested in calling on the president. We are interested in calling on the minister for health. We are interested in calling on parliament. All of them who have to ensure that they bring their mind on the table of controlling TB so we can end TB by 2030.
Now, what are the commitments you're applying to this fight? I mean, resources, obviously, and how you generating those resources.
Yes, so in Ghana particularly, you have almost all the budget that we use to control TB, HIV, and malaria come from the Global Fund, of course, with some counterpart financing arrangements with the government of Ghana. And so, in most cases, we are not able to, government of Ghana is not able to fulfill all their counterpart financing requirements. And therefore, we always have a reduction in how much can come to us as a country to control TB. So, for example, we are looking at the budget that the National TB Control has is about $18 million to be able to do an effective TB care control in Ghana every year. But the current budget they have, because of the support from the Global Fund, they are able to spend about $7 million a year. So what it means is we are in deficiency of about $9 million. And so we are not able to do all that we have to do to make sure we reach all the people we have to reach in order to get people put on treatment and then making sure they are cured and then to eradicate TB from this country.
Well, viewers, we are taking another short break, and when we come back, I'd like to find out concretely, what is it that we need to do? Find more money, find more drugs, train more doctors. What is it that we have to do in order to win this fight against tuberculosis? Short break. Welcome back to Talk Time, and we are talking about tuberculosis. Sir, what is required to win the war against tuberculosis?
So we need, at this stage, we need political commitment, which obviously comes to financing tuberculosis, long and short of it. So that comes to take it from the history of the pandemic, COVID. The moment we had the pandemic come, the president allocated a facility of about $200 million to ensure that tuberculosis, COVID does not wipe away the people of Ghana. Simple. If we have the government of Ghana at the level of government supporting or financing tuberculosis, in addition to the support we have from our development partners, we should be able to do it. Now, it is not just a matter of financing the program. If you are financing the program and you are not monitoring the program, we are not likely to get there. What it means is that we are calling on the high level, we want the high level powers of the president to come on the table of tuberculosis. If the president is financing TB, the president should be able to get interested in how the people who are responsible, the duty bearers across the country that are responsible for this, and how are they performing. So, for example, one of the commitments that the president signed on to in New York is to form a multi-sectoral accountability committee, which never was realized. If we have that committee in place, for example, that is meeting maybe every quarter or every month to hold the program, the TB program manager, to hold the Ghana Health Service director, to hold the Minister for Health or Parliament, once there is an accountability mechanism to ensure that what needs to be done is being done. Where there are challenges, they are being expressed, and then there is an address, or we are addressing them at all levels. We should be able to end TB. So we need domestic financing. We need political commitment from the president and all the Minister for Health, the Minister for Finance. Parliament need to get interested. We need this high-level political commitment. We need a financing, and we need accountability framework to ensure that we're able to save the lives of Ghanaians who suffer from tuberculosis. Thank you.
But have we had any interactions with the Health Committee of Parliament?
Yes, we have had some discussions with the Health Committee of Parliament last year. This year, in fact, we are going to have to launch parliamentary TB caucus. So what we are trying to do as a civil society movement is, how can we get a debate about TB in Parliament? And we've come up with the idea that, okay, there are some members of Parliament who are health activists and who are also interested in TB. So in that meeting with, I think, Dr. Ayu and his team, we had an agreement that, okay, we're going to form parliamentary TB caucus. Hopefully next month, in the last week of May this year, we will launch that caucus in order to ensure that we are able to use a set of people in Parliament who can be, who can entrench arguments about TB in the work of Parliament. It's important for us, and we're going to do that. Look, you know that Parliament does a lot of work, even around finance and all of that, budget allocation and all of that. So once we can have some activists in the health committee and other committees that are interested in Parliament, we are hoping that we will be getting there to ensure we are having even Parliament looking at whether there are allocation enough to this disease in the next budget that will be read.
Yeah, you talk about resources that are needed, the need for government to make a commitment and so on. Concretely, can you quantify?
Yeah, I think that's what I said earlier. I said the National TV program has a budget of $18 million a year if we want to end TB by 2030.
So all you need is $18 million
a year, each year.
More.
Now, that will be able to take care of every diagnostics, every supplies into every part of this country.
Medical personnel.
Yes, that is the budget.
$18 million.
$18 million annually, we should be able to. And that is why I said that we now have $7 million of budgets being run by the National TV program. If we are able to get additional 11 million rather, every year on top of what the Global Fund provides, we should be getting there. In fact, the Global Fund's allocation to Ghana is already out, which is $18 million for the next 3 years. And the next 3 years, I'm referring to 2024, 2025, 2026. And we already know that budget. It's only $18 million. And this is going to spread across the 3 years. So clearly, in the next 3 years, if we are talking about a budget of 18 million, so it's 18 million times 3 in the next 3 years. And so if we already have some $18 million, government has to come in any other form or shape to ensure that we are able to meet the demand of the program.
So thank you very much for coming to the studio. Thank you so very much. Well, viewers, we've been talking to Mr. David Kwesi Afreh, who is the board chair of the Stop TB Partnership Ghana, which is dedicated to fighting against the spread of tuberculosis, which is fighting for the elimination of tuberculosis. And he says that $18 million a year for the next 3 years would do that. Parliament, Ministry of Finance, what are we going to do about this situation? Until we meet again next week, is goodbye from me, from the director of the show, Gerald, from the cameraman, from everybody, from our floor manager, Lydia, and also from our producer, George Vinay. Bye-bye until we see you again next week. Bye.